Hi there, everyone. I'm Dr. Karen Trainer, and I'm excited to be sharing with you um, a case today. And we're going to go through the images, and we'll go through scan slide and some special stains. And I hope you'll enjoy that. But if we haven't met before, just to introduce myself, I'm Dr. Karen Trainer. I run Innovative Vet Path in the Kansas City area. And I read cases for clients all around the Kansas City area, but also across the country. And I also consult on germ path cases internationally as well. And I do teaching, and I'm so glad that you're here today. So feel free to reach out anytime if you ever have any questions. I'm going to share my screen so you can see what I'm going to be showing today with this case. And we're going to cover a case of cryptococcosus, and we're going to see some different examples of that, and I'll share that with you. Just some quick facts right off the top. Cryptococcus has a worldwide distribution, and cats are especially prone to developing these lesions, and it's the most common systemic fungal infection of cats. And there's some thought that perhaps immunocompromise is a consequence rather than a cause of the disease. And lesions can be localized, either involving the nasal cavity, the respiratory tract, the skin, or the central nervous system, or it can be systemic. Inhalation is the most likely route of transmission for this, with hematology spread to other locations. And it has a distinctive mucopolysaccharide capsule. And it creates this classic soap bubble appearance on histocath, and that's what I'm going to show you in these cases. And the organisms themselves, the yeasts, are about 2 to 10 microns in diameter, and then they have this really cool capsule that surrounds them. It's a mucopolysaccharide capsule, and that can vary in thickness from about 1 to 30 microns in diameter. And these Cryptococcus demonstrates narrow base budding, and I'll show you some examples of that. And what's really interesting about this agent is that it tends to be associated with a very sparsely cellular inflammatory pattern. So there tends to be very few inflammatory cells as compared to other types of fungal infections or other agents. So some differential diagnoses that you might come up with for this include blastomyces, histoplasma, coccidioides, or as we talked about last week, leishmania, depending on the location of the patient. So these are some other differentials, but you can tell them apart based on some of the special stains and then some of the characteristics, like blastomyces has broad base budding, so lots of V's with that one. And the organisms are a little bit larger. It ranges from maybe 8 to 25 microns. Blasto, we often say blasto is big. Histoplasma is around the same size diameter. It's about 2 to 6 microns. It also has narrow base budding, but that tends to be an intracellular organism within macrophages or histiocytes, and it has no capsule. So that's one way to differentiate it. Coccidioides is, if blasto is big, coccidioides is ginormous. It's really gigantic. It can be smaller, of course, than 100 microns diameter, but it can get up to that size. So it's much, much bigger. It does not have a capsule in quite the same sense. It doesn't have a mucopolysaccharide capsule. And it also reproduces by endosporulation rather than by budding. So that's a key way to differentiate it. Also by geography as well. Those of you that see cases from the southwest of the United States or central South America or portions of Mexico, you might see that. And Leishmania mexicana, we've talked about in cats as a differential for cutaneous lesions, especially if they're on the face or around the nose. The clinical presentation, lesions tend to be firm or fluctuant nodules on the head or face most often. Occasionally they can be ulcerated. And some cases will present with sneezing, nasal discharge, but the most classic feature of this in cats is swelling of the nasal bridge. And that's in profile when you see this. This is called a Roman nose appearance. So that sort of bowed appearance in the profile. So on cytology, you can certainly see mixed inflammation, but you'll see this thick mucopolysaccharide capsule. But histopath, and you can see that clearing around the organisms and then the narrow base budding. And then on histopath, we see very little inflammation, but tons of organisms. So let's go to the slides and take a look at that. So I'll pull that up for you. And so here is our histopath slide. And this is an example. We're looking at, of course, at haired skin. And here we have the normal haired skin. This is from a cat. And then we just see all of this white with lots of sort of purple dots everywhere. So typically, this is a pretty classic appearance. There's very few inflammatory cells associated with this. There are certainly some foamy macrophages scattered throughout, but it's not as densely cellular as we saw last week with the leishmania. So that's an important distinction. And then as we're looking around, you can see within all of these clear spaces, there are organisms. And these have, here's an example of narrow base budding right here. And we can see these organisms have sometimes like a almost collapsed shell-like appearance. Looks like a round structure that's partially collapsed. And here's more narrow base budding, more examples of that. So it's just, I think someone had mentioned when I posted a preview of this, it was sort of a party. I think that is spot on. Excellent description for this. So these guys do like to party, and they usually show up in pretty large numbers, but you can already, even on the H&E without special stains, you can get a sense that there's some sort of a capsule around this organism. And there's something that's creating that space within the tissue. And so most of the inflammation that we're seeing is mostly histiocytic. There are a few neutrophils here and there. Sometimes you'll see lymphocytes and plasma cells. But this is pretty classic for how it presents. And again, you can see at the low mag, if we come back to that, it's a somewhat nodular appearing lesion. And in this case, it is partially ulcerated. And we've got some erosion as well, and then some development of crust on the surface, some exudate. That is fairly common with this presentation. And so I'll just show you a couple more examples. We'll go to a PAS stain from this case. Now, this is a PAS with a green counter stain, and I really like this for derm path. I think it shows things beautifully, and it's really nice to see the narrow base budding. So it highlights the organisms beautifully. So with the PAS and the GMS, you're actually staining the yeast themselves. And I'll show you another stain that will actually stain the capsule. And that's something that is this mucopolysaccharide capsule that cryptococcus has, is something that is unique to this as a pathogenic fungus. Most other types of pathogenic fungi and yeast, in fact, I don't think there are any other, but please let me know if I'm mistaken in this. I don't think any other pathogenic agents have this mucopolysaccharide capsule. So let's go to that. We'll go back to our presentation here. So this is the case we were just looking at. And again, here are the organisms, and we can see that nice narrow base budding. And we've got a juicy cell right here. This is a mott cell filled with Russell bodies. And so that's interesting. And so this is the stain that I posted in the preview. This is a Myers mucicarmine. And so this actually stains the polysaccharide capsule rather than the yeast organism itself. And so that's what's distinctive about it. In this particular case, there were a lot of foamy macrophages, so those are in the background. But this is a really beautiful stain, and it is just the perfect one to do if you suspect cryptococcus. It would be a slam dunk if you do this stain. Because there are other stains you can do, like I mentioned, the PAS and the GMS, but it might be a little bit more difficult to differentiate between some of those other agents. I do think the PAS shows the organism pretty well. And something I think is distinctive for cryptococcus is a sort of collapsed appearance to the agent. These sort of crescent shaped, you can see where it was a spear-like yeast organism, and then in some areas it's collapsed. So I do think that's interesting, and that's something that I think is unique to cryptococcus. But on the GMS, you can again see this one's very cellular. We've got the narrow base budding, but it might be a little bit harder to differentiate from some of the other agents if you just have the GMS. And that's why the UC Carmine is so beautiful. So these are some fun special stains, because I know sometimes in pathology we do special stains, but it can be somewhat unrewarding or difficult to interpret or equivocal. We all probably dread that word, equivocal. So these were fun cases to do special stains on because it's very satisfying to get results and confirmation of what you're looking for. So I just wanted to share this fun little case with you, and I hope you enjoyed it. Please let me know if you have any questions, and I'll do my best to follow up and answer them. And I will see you next week. All right, take care. Bye.